We have a number of questions. If we can continue straight on, it'd be great if we can get a response. I think, Liz, maybe for the first question, which is about the sensation when you apply Accel-Heal for the patient. Is it like TENS or is it different? Is there any sensation at all? Liz, are you able to respond?
Yeah. Well, as Robin was saying, it is subsensory, so it is very low electrical energy, much lower than is used for TENS. I actually haven't had any of my patients say they can even feel the therapy when they have it applied. If I put it on my arm myself, I tend to feel a little bit of a tingling, probably because I'm a little bit maybe dehydrated or I haven't got a wound to think about, so all I focus on is the electrode pads. But none of my patients have actually had any sensation from using the therapy. They don't actually even know that they've got it on, and in fact, because the pain is reduced, it's if anything, it's a beneficial sensation.
Right.
And my patient had no sensation either.
No.
She didn't even know she had it on. Yeah.
Yep. Fantastic. Thanks. Excellent. Is it able to be used for deep wounds as well, such as, say, a stage 4 pressure injury? Liz?
Yeah, you can use it for any wounds. I've used recently, one of my tissue viability nurses that I work with has used it for a grade category 4 pressure ulcer. And it was on the sacrum, quite extensive, and it healed very, very quickly. So you would do your usual standard wound therapy, you know, if you needed to pack the wound, manage the exudate, and obviously it may be slower than a superficial wound, but it should hopefully start to stimulate the wound. We've also used it for pilonidal sinus wounds as well, very successfully.
Great, thank you. Can you comment, I think, to Liz as well, with your experience on the need for patients to adhere exactly to the 48-hour timeframes for changing each device if the clinician can't always be present to monitor, despite education instructions? Some patients extend these times while the lights are still flashing after 48 hours.
Yeah.
So is that going to affect safety or out?
It won't affect safety. It may affect the efficacy of the therapy. Obviously, ideally to wear it for the full 12 days continuously. But, you know, as I said, the patients who want to have a shower can disconnect it for a short period and reconnect it. But, you know, ideally to have it on over the full 12 days. But it won't certainly have a negative impact, but it just may be, you know, if it comes off during the resting phase, perhaps not such an issue, but to keep it on as much as possible.
And in this case, indeed, extend a little bit. I'm not quite sure how long the device would keep working.
It may then run sort of for a bit longer than the sort of end of that 48-hour period on the 12th day. So just to be mindful before they actually remove the final device to ensure that the light has gone off, that the therapy is completed.
Okay, great. Paul Burrows has asked the question. Thanks, Paul. How does the therapy, again, I think, Liz, if it's okay, I think this is relating to one of the wounds that you showed. How does the therapy pass across or through wounds when the electrodes are not either side of a wound, as in the example of the toe wound, with both electrodes on the dorsum of the foot, not near the toe?
Yes, so as Robin was saying, as I mentioned, because it's current controlled, the electrode pads actually are monitoring that the voltage, and can control the voltage that the wound gets the right therapy that's needed according to the program. So the electrode pads can actually be applied quite a little bit away from the wound edges, and will still have the same therapeutic effect.
And indeed on the other surface of the foot. So how far does the actual current travel?
I think maybe
Shall I jump in here? So we've done a few limited experiments with a healthy volunteer using a little portable ECG machine to probe. This is a volunteer with no wound, just normal skin. But what you do find is, for example, with the electrodes placed as Liz did on the dorsum of the foot, if you apply on the plantar surface, you can detect the electric signal. So what you have to think of is that as the current flows into the skin, it does have some quite lateral flow. And we find that, you know, on a constrained area like the foot, apply it on the dorsal, you can see the current on the plantar surface.
Okay, great. Okay, next question, I think you as well, Robin, if that's all right, from Lisa Hewitt. She noticed in the RCTs that showed the 1.7 times faster healing. Was that just in acute wounds?
Right. Okay. So yes, I did go extremely fast, and I'm sure someone from Accel-Heal could provide you with the paper or see the abstract. So that was a relatively small RCT on venous leg ulcers, so chronic wounds. Some of the chronic wounds had actually been in existence for quite a long time, so quite difficult subsets. It's quite difficult to heal. The 1.7 applies to those wounds which that actually went on to heal in the placebo group and the active Accel-Heal group, and that reflects the 1.7 times faster for those wounds that actually healed.
Right, thank you. And a last question for you, Liz, if that's okay, regarding the man with the diabetic foot wound that experienced significant pain reduction. What happened after the 12-day treatment?
So the patient with the arterial ulcers at the end, is that, I presume that's the study that the case
Yes.
talking about, yeah.
Yes.
Well, the pain continued to remain reduced. And as you saw in the photo, the wound actually progressed to complete healing within the 9 days, within 9 weeks, sorry. You know, the whole tissue changed, actually. It became much softer. So that, no, the pain remained low. In fact, it actually became that she had no pain. And then she ended up, eventually she had her vascular intervention to try and prevent it, really. Yeah.
Great, excellent. Thank you so much. They were great responses. That's it for the questions. Thanks, Chris.
Thanks very much, Judy, and thanks again to all the panelists and all the presenters this evening. Much appreciated for that. Sorry we've gone a little bit over time, but please reach out to Alliance Medical Solutions and any of the team. You can reach us at info@alliancemedicalsolutions.com.au, and we'd be happy to provide the further papers, evidence, and some of the early case evaluations that we've had in Australia. It's been fantastic to see the clinicians getting excellent results and fantastic outcomes for patients and improvement in quality of life with these really recalcitrant and very complex type wounds, as Geoff and Linda have shown you tonight. So thank you, everybody, and thank you for your attendance. We look forward to sharing the recording with you. But for now, thank you and good evening.